Good afternoon. Thank you for joining the Second Chance Act Statewide Recidivism Reduction Planning Grant Program Orientation webinar. The purpose of this webinar is to share information about the SRR Planning Grant, including steps to develop your statewide recidivism reduction plan, submission of the Planning and Implementation Guide, and related timelines. We will also discuss resources that are available to support your planning grants, and will answer questions about expectations for the planning process. My name is Heather Tubman-Carbone. I'm a Technical Assistance Manager at the Council of State Governments Justice Center, and I will be presenting today along with Andre Bethia, Policy Advisor at the Bureau of Justice Assistance, U.S. Department of Justice, and I'm excited to share that we are also joined by Dr. Beth Skinner, Recidivism Reduction Coordinator for the Iowa Department of Corrections, and FY2013 and 14 SRR Grantee. Thank you all for joining the webinar today, and to BJA and Iowa for partnering with us on this presentation. The Second Chance Act has supported over $300 million in reentry investments to a variety of initiatives across the country. The Bureau of Justice Assistance administers these grants, including the Statewide Recidivism Reduction Program. Today's webinar is organized into 4 parts. First, we'll introduce the CSG Justice Center. Then, we'll provide an overview of the SRR Grant Program. Andre will walk us through some of BJA's expectations for grantees and some key program requirements. We'll also hear from Dr. Skinner about Iowa's recent experience with an SRR planning grant and how that has informed their current implementation work. Next, we'll talk about the SRR planning grant process and related technical assistance available to support your work. We will wrap up with a question and answer session. Throughout the presentation, please don't hesitate to type any questions into the Q&A box at the bottom right-hand corner of your screen. You can also include technical questions, and we will address any questions that we can throughout the course of the presentation and at the end. Some technical difficulties may be impossible to resolve during the webinar. This webinar is being recorded and will be posted on our website, and we will send you an email link once it is available. The Justice Center is a national nonprofit organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff at the Justice Center provide practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. Within the Justice Center, the National Reentry Resource Center is funded by the Bureau of Justice Assistance, and we provide support to Second Chance Act grantees and the broader field. The Second Chance Act, which was signed into law in 2008, is the first federal legislation to authorize federal support for reentry programs. Recognizing how complex reentry initiatives are and the importance of integrating research and evidence into those initiatives, the Second Chance Act authorized the creation of a National Reentry Resource Center for adult and juvenile reentry. In 2009, following a competitive process, the CSG Justice Center was selected to launch the National Reentry Resource Center and provide training and technical assistance to Second Chance Act grantees. We administer the NRRC in close partnership with BJA. On behalf of the staff and board at the CSG Justice Center, I congratulate you on your selection as a Second Chance Act grantee. The Second Chance Act grant programs are highly competitive and sought after, and policymakers at the federal, state, and local level are looking to Second Chance Act grantees to advance our understanding of effective reentry and recidivism reduction practices. We are committed to providing support that will help you make the most of your grants and look forward to working with you as you plan your projects. The National Reentry Resource Center has 4 main objectives as a training and technical assistance provider. We provide a one-stop interactive source of current user-friendly reentry information. We identify, document, and promote evidence-based practices, and we advance the reentry field through training, distance learning, and knowledge development. We also deliver individualized, targeted technical assistance to Second Chance Act grantees, such as yourself. Every grantee has been assigned to an NRRC staff member who will reach out soon to learn more about your project and to provide you with individualized technical assistance. In the meantime, however, there is a wealth of information available on our website that may be helpful to you as you launch your projects. I'll spend just a few minutes walking you through those sections of the website that you may find particularly helpful. The National Reentry Resource Center website has issue pages where we provide content on key reentry topics such as health, employment, and performance measurement. Each topic page provides links to recent research and publications as well as news clips about that subject. The NRRC regularly hosts webinars on a wide variety of topics related to reentry. All webinars are recorded, archived, and available on our website. You can find these distance learning tools under Resources. Also under Resources, you can find a Publications page. The NRRC is building a large online library of publications. To date, there are over 1,200 items online. Through the search box on our site, you can access our publications as well as any publications in our library. The Justice Center is also home to several projects, such as the Reentry and Employment Project and the What Works in Reentry Clearinghouse. The Employment Project is rooted in working with business leaders, policymakers, and practitioners across the country working in corrections and the workforce to collaborate on the goals of improving reentry and employment outcomes for individuals with criminal histories. The Clearinghouse is a one-stop shop for research on the effectiveness of a wide variety of reentry programs and practices developed in partnership with the Urban Institute. You'll notice that the largest red circle on your screen is around the Statewide Recidivism Reduction Grant Program. This page is dedicated to the grant program which you are now a part of. More on that in a minute. We are constantly adding new resources, webinars, funding opportunities, and other news to our website, and we send out a monthly newsletter that will connect you to those new resources. We encourage everyone on the webinar today to sign up for our newsletter, which you can do on our website by clicking the subscribe button circled in red. I mentioned that your NRRCT provider will be reaching out soon. Here's an overview of the grantee orientation process. Your agency should have joined a webinar for all fiscal year 2015 Second Chance Act grantees on October 22nd. Today, we'll dig into the specifics of the SRR grant program. In late November, early December, your individual technical assistance provider will reach out to schedule an orientation call to kick off individualized technical assistance. You will meet your TA provider, each other SCA grantees, and experts in the field at the Second Chance Act Conference in Washington, D.C. in December. By now, you should have received an email inviting you to register for the Second Chance Act Conference. If you have not received the invitation, please email me after this webinar. My contact information will be displayed at the end. Now, let's get more specific about the SRR Planning Grant Program. Congratulations to everyone on the line today. BJA selected your 7 states out of applications from across the country. On the line today, we have Connecticut, Virginia, Indiana, Alabama, Colorado, Arizona, and Nevada. You are joining a small but impressive group of states in the Statewide Recidivism Reduction Grant Program. Take a look at the list on your screen. All of these states received planning grants in fiscal year 2013. The states in bold went on to receive implementation grants in 2014 and are working to implement their statewide plans as we speak. As TA providers, we will connect you with fellow SRR states in your region or that have pursued similar strategies. There are multiple Second Chance Act grant programs. Nearly all of those programs are designed to focus on a specific strategy to improve reentry outcomes and increase public safety. For example, you may be aware of the technology career training programs or mentoring programs, as well as grants to expand programs for individuals with co-occurring substance abuse and mental health disorders. Plainly stated, the Statewide Recidivism Reduction Program is bigger. It's more comprehensive, competitive, and higher profile than its counterparts. The SRR grant program is unique in that it is highly visible and more competitive than other programs. SRR grants are for the state and they're managed by an agency. This is a collaborative opportunity for all stakeholders in the states awarded. The SRR grant program requires that you convene stakeholders and develop and then hopefully execute a statewide reentry plan. This work may build on or tie into related initiatives that are new or ongoing in your state. The SRR program requires that you focus on evidence-based strategies, those strategies that research proves have been shown to reduce recidivism outcomes and improve public safety. Also, BJA expects that SRR grantee states will become state centers of excellence and serve as national models. With greater excitement and opportunity also comes a greater challenge. Therefore, this is a two-phased grant program. In the first phase, which you've just been awarded, folks are expected to work on planning and capacity building. And later in the webinar, we'll walk through some of the steps that are involved in that process. At the end of this planning grant period, everyone will submit a proposal to receive implementation funds. That would be phase 2. At this time, I'll turn it over to Andre to talk more about BJA's requirements and expectations for the planning grant program.
Thank you, Heather. And I want to start off by saying congratulations to all grantees. We're glad to have you and your states represented in this cohort. The purpose of the Statewide Recidivism Reduction Planning Grant is take a planning and capacity building approach to develop a sound organizational infrastructure to support targeted programmatic interventions which should result in the desired reduction in overall recidivism. Collaborative strategic planning should guide systemic capacity building and eventually lead to the implementation of evidence-based programmatic interventions targeted at specific reentry populations to achieve the desired goal of overall recidivism reduction. Next. Statewide Recidivism Reduction Planning Program expectations. Up to $100,000 for a 12-month project period to develop strategic plans, including establishing a collaborative decision-making body and planning process, taking a data-driven approach to recidivism reduction goal setting and planning, assessing current recidivism reduction policies and implementation gaps and barriers, developing an SRR implementation proposal. Program requirements, planning, and capacity building. Provide a statewide definition of recidivism and demonstrate the capability to access and obtain data. Define realistic but ambitious recidivism reduction goals. Convene an SRR task force of state leaders and stakeholders. Review the state's strengths and areas for improvement regarding strategies demonstrated to change behavior and reduce recidivism. Research indicates that specific types of strategies are effective to reduce recidivism. Risk and need assessment to determine program/service placement inform the release decision, set supervision conditions and reporting requirements, and inform the response to non-compliance or violation behavior. Pre-release planning. Programs provided are designed to change criminal behaviors and are grounded in research. Quality is reviewed using a structured quality assurance process, and steps to improve program quality are taken based on the findings. States should also consider capacity to provide needed programming. Effective supervision strategies are used to encourage compliance with conditions of release and to ensure effective responses when someone does not comply with those conditions of release. And we've developed tools to just do that. We'll discuss them in a few minutes as part of the technical assistance. For now, I'd like to introduce Dr. Beth Skinner from the Iowa Department of Corrections to tell you about Iowa's experience. Iowa received an SRR planning grant in fiscal year 13, the same grant you all received this year. They used that grant to assess their system and develop a very competitive proposal about what they would change. That proposal was funded in fiscal year 14 with an SRR implementation grant.
Great. Thank you, Andre, very much. And I want to echo your sentiments, too. Congratulations to all the states that received planning dollars, and best of luck in the planning process. Also, I want to thank Dr. Heather Tubman-Carbone as well as Andre for letting me share our experiences here in Iowa on this webinar, and also for the Justice Center and the great support and technical support they have provided us over the last couple years. So thank you to you all. I want to really touch on kind of 4 pieces here of information that I think may be valuable to you all as you're moving through the planning phase. First of all, I'd like to talk about, what's the value of SRR to the state of Iowa? Like, what kind of value has it brought to us? One thing it's really afforded us an opportunity to do is examine organizational culture and organizational development. What we recognize is that for anything really to happen and stay in sustainability in terms of practices, strategies, we need to make sure that we have the right culture and pay attention to our organizational development for these different practices to last a long time. Another thing it also provides us with a focus on the infrastructure building and enhancements. Most of the time, as you all probably can imagine, is that we never seem to have enough time to focus on organizational development and culture and building on our infrastructure. And we're usually in crisis management mode versus working on the development piece. So this really provided us an opportunity to be very thoughtful and strategic around organizational development and culture. Also, it provides an opportunity to, develop new and enhanced collaborations across the state. Opportunities really to break down silos with partners, some partners that we've never worked with before, and realizing that we all share really the same client as well as the same goal, which is safer communities, more productive community members. And then finally, I would say is it also has really broken down the internal silos between community-based corrections, which is probation, parole, and work release, and our institutions, and it has helped us and propelled us to be more of an integrated system. So that definitely has been some benefits, the value that we've seen thus far. Also, another piece I think is important to know is like what was the value of the two-phase process of planning and implementation. Well, I think the value I see is that when you have a planning phase to something that's this large and comprehensive, it gives you time to strategize and develop a process versus concurrently trying to plan and implement at the same time. When you do that, and many of you probably know this and maybe at a smaller scale level, is when you plan and implement at the same time, you tend to miss things, have issues around sequencing, skip steps, or lose people because they become overwhelmed with the process. Also, the two-phase process also helps us develop a work group model. We use the same work group structure in our planning as well as now as the implementation phase of this grant. That way it helps with continuity and it's more seamless. So that's been very helpful. And a third piece, too, of the value of the two-phase process is really forced us into project management, to a project management approach, as well as to develop work plans, timelines. And this actually has taken hold across the state. We have our executive leadership now using work plans, utilizing work groups. So it has been, has really started to settle into our infrastructure. The third piece I want to just touch on is, what are some of the key steps that we actually, what do we undertake in the planning process that might be useful to you all? One thing, and first and foremost, is having more of a data-driven approach to gauge, the needs of your organization as well as the gaps, and also to do, universal kind of assessment of the review of your policy and practices, especially when you talk about practices that specifically impact recidivism reduction. Again, one of the key things was developing a work group model to identify and plan for key activities. We put our work into different buckets like job classification, competency, training, workload, pre-release planning, and had these groups identify what kind of key activities should be done around each of these different areas. And now we're using them in our implementation phase. The second thing that was really helpful is we actually used an outside facilitator to assist with the planning in order for leadership to participate in the meetings. So instead of leadership facilitating these meetings, we actually brought an outside person to facilitate it so the leadership could actually be in those meetings and really being part of that brainstorming that was going on around this planning phase. We also developed a high-level structure to organize the work and parse out roles, develop process, and create buckets of key approaches that we believe would reduce recidivism. And then we really kind of formed all this on the foundation of a participant model, which means we use staff from all levels of the organization, which vary in experience and knowledge, and we include them in the planning process. We basically did this through our work groups. My final thing is, I guess I would say my final maybe kernel of wisdom as we've moved from planning to implementation. What are some things that I think I'd want to know that, I wish I had known like ahead of time, is that first and foremost, be thinking about your organizational culture and organizational development. Otherwise, as I mentioned earlier, the collaboration and utilizing EVPs and all these evidence-based practices are much more difficult to stick when you don't have the culture and organization to support it. Second would be engage partners early on in the planning process and create buy-in. How the work actually not just benefits Department of Corrections, but how it benefits them, since we share a lot of the same clients. Third thing that's been very successful for Iowa is we really developed a vision on how all the work in DOC, along with our stakeholders, our agency partners, we're all trying to achieve the same thing, which is safer communities. So we all have a role in this. It's not just DOC. One thing I think is also, last 2 points I think are very, very important as well, is to understand implementation, how to implement and what the barriers are to implementation, as well as building accountability into your plan, as well as sustainability. Final thing I would say, my last words of wisdom I would say, is messaging. Really committing the time and resources, especially from leadership, to informing staff, line staff, stakeholders, the public, the goals of the grant and how it's a joint effort and what, how it's going to make, the community safer. So those are, I would say, are probably my 4 main points that I think are important to know as you are planning grants and moving forward into the competitive process of implementation.
Thank you very much, Dr. Skinner, and thank you, Andre, also for walking us through some of those requirements. I hope the information that Dr. Skinner shared was helpful to get you oriented to the types of changes that we've seen folks put into their planning grant efforts. And now, in this next section, we'll talk more concretely about the SRR planning process and the technical assistance available to support your work. The Bureau of Justice Assistance administers the SRR grant program. You're accountable to them for financial and progress reports, and state policy advisors at BJA are your point of contact for reporting and budget-related questions. The next group you see on the slide before you is CSR Incorporated. CSR administers a performance measurement tool that you're responsible to complete at regular intervals as outlined in a grant solicitation. And last on that slide, you will see the National Reentry Resource Center. We provide a wide variety of support related to content and facilitation. Our role is to help you meet the requirements of the grant to develop a statewide recidivism reduction plan. In doing so, we can provide some education and learning opportunities for staff. We can share lessons learned across jurisdictions. We can facilitate conversations with federal partners and experts in the field. We can also spend some time supporting policy and procedure review and rewrites. Another important part of our role is to translate research to practice. For example, if you're thinking about implementing, say, a motivational interviewing curriculum, we can help to dig into the research and identify the best ways to use those skills and recommend some trainers. And we do all of that in a variety of ways. Every grantee will have a standing monthly call with your TA provider, and at times you'll be in more frequent communication via phone and email. We are always available to answer questions and to provide the various types of support you saw on the previous screen. We will also have at least one site visit to each grantee. We can connect you to experts in the field and have a strong bench of consultants to the project. They may join us on site visits and calls at your request. There will be many commonalities across your SRR projects and with past grantee projects like Dr. Skinner's. Those commonalities will include various trouble spots, and we can bring forth lessons learned and share resources. Some additional aspects of TA are unique to the SRR grant program. As Andre mentioned earlier, CSG has developed a roadmap to guide the development of your statewide plans. There are 3 items listed on your screen. The first is a series of recidivism reduction checklists. These are self-assessment tools to determine whether and how your state's practices align with evidence-based practices. The second, you heard earlier about how SRR is a four-phase project. How SRR is a two-phase project, planning and implementation. We've developed a process outline that breaks it down further into 4 stages with 3 steps in each. During the planning grant, you'll complete the first 2 stages, exploration and development, by taking stock of the reentry and recidivism landscape in your state and planning strategies to improve it. Then, once you have a plan, you can move into the installation and accountability stages, where you'll put the changes into action and develop quality assurance and assessment mechanisms. The third tool on this slide is a planning and implementation guide, or as we call it, the P&I guide. This one should sound familiar as it is a requirement of the grant program listed in the solicitation. The P&I guide is made up of 4 sections. It is a meaningful requirement because each section builds on the preceding one, and taken together, the sections lead to the development of your statewide strategic plan. BJA requires all planning grantees to complete the P&I guide, and technical assistance is available as you work through each section. The first step in the SRR planning process, and therefore the first section of the P&I guide, is about establishing a planning team and a process for convening members and completing the grant work. In order for the planning phase to be successful, senior-level representatives of all relevant agencies and organizations must participate in a collaborative planning process that leads to the completion of the discrete deliverables expected by BJA. This section of the guide outlines key aspects of a collaborative decision-making body and will help you decide who should be at the table and how to effectively structure the planning process. For example, as Dr. Skinner shared, you may develop work groups to guide different strategies. In the first exercise in this guide, you'll be prompted to answer questions about the composition of your planning team, about the structure, and about the process that the group will undertake to complete grant deliverables. The second step in the SRR planning process is to analyze recidivism data. The purpose of the SRR grant program is to help states lower recidivism through evidence-based targeted policies, programs, and practices. As such, it is important for everyone to begin the planning process with an assessment of your statewide recidivism rate to identify factors that may affect that rate. Then you should set ambitious but attainable recidivism reduction goals. BJA expects that applicants for implementation funding will be able to measure these key data points. This section of the Planning and Implementation Guide is designed to help you use data to define and measure your current statewide recidivism rate, to understand the key drivers of that rate, to identify a target population for interventions and policy changes based upon the drivers, and to set recidivism reduction goals for the target population and statewide. Many of your agencies may already monitor these types of data. However, that is not universally true. Some states will need to undertake new data analyses to complete this section of the guide. The third step in the SRR planning process is to assess current recidivism reduction policies and barriers, as well as gaps in implementation. This section of the P&I guide provides background on 3 evidence-based principles. The principles that you see before you on the slide reflect the policy areas that BJA expects you to focus on when planning your recidivism reduction initiative. The third section of the guide also includes the recidivism reduction checklists referenced earlier. Those will allow you to assess your current policies and practices to ensure they will reduce recidivism and achieve other common reentry goals. The checklists, again, address the 3 areas on your screen: using risk and needs assessments to inform resource allocation decisions and individual case responses, establishing programs and practices that reduce recidivism and ensure they are implemented with fidelity, and implementing community supervision policies and practices that promote successful reentry. Your planning team should assess the status of implementation for each of the items in the checklist and identify barriers and gaps to implementation. All of that work culminates in the final section of the P&I guide, which positions your team to submit an SRR implementation proposal once the solicitation is released by BJA. This section in the P&I guide contains information about the different types of proposals supported by the SRR program, including strategies to address the barriers and gaps identified in prior sections and to reach your recidivism reduction goals for the target population and statewide. Section 4 in the guide and the resulting proposals are organized around efforts to build capacity within your agency to support the adoption of evidence-based practices, as well as investments in evidence-based programs and interventions for the target population. At the end of this process, your planning team should have developed an implementation proposal as well as an evaluation and sustainability plan. This concludes the presentation portion of today's webinar. I appreciate that we just shared a lot of information. Shortly, you will receive the Planning and Implementation Guide, and as well, when you're in touch with your individual TA provider, we can provide greater detail. With that, we'll go ahead and answer some questions. Please enter questions in the Q&A panel in the bottom right portion of your screen, and we'll get to as many as we can today. We'll be sure to follow up about any questions left unanswered in our limited remaining time. Please enter any questions for the Justice Center, for BJA, or for Dr. Skinner. While we wait for some questions to come in, we will display contact information. Please do not hesitate to follow up with any of us directly. We have our first question, and this, I believe, is a question for BJA. We've been asked, when will the implementation grant solicitation be released in 2016? Andre, do you mind taking that?
Not a problem, Heather. Actually, the implementation solicitation, well, the solicitation for the implementation grant does not have a finalized date as of yet, but I suggest that you will have enough time to get through your complete planning phase and enough time for you to be able to apply for the solicitation. Our solicitations are usually out on the street about 60 days, so that should be enough time for you to, and if you need help, to get help from your TA coach as well.
I'll also add that by going through the Planning and Implementation Guide process, this won't be like other grant proposals where folks look at a solicitation and sort of feel like you're starting fresh or are unsure of what initiative to build on. Rather, looking at that implementation solicitation will be a very logical next step to the planning grant process. I see our next question is about the Planning and Implementation Guide and asks whether the guide will be finished by June. The P&I guide, yes, it is to be finished by June. I'm going to jump back a couple slides if you all will bear with me. We proposed the timeline that you see on your screen now, where there's a sort of a quick turnaround in order to establish a planning committee and analyze recidivism data. And we think those are pretty feasible because in order to apply for the SRR planning grant, you've probably done a substantial portion of the looking at your recidivism data. The next mark that we recommend is by the end of April to have reviewed policies and practices to identify some areas that you may want to do some work in. And then that's where you see that June date. And again, we suggest that date, and I should say it is required by BJA because that sets you up in order to deliver the most competitive SRR implementation proposal possible. Our next question is about the Second Chance Act conference in December, and we've been asked whether it is essential that the financial point of contact attend the conference in December. And thank you, that is a great question. It is absolutely not essential. This is, there will not necessarily be information at the conference about the administration of grants. It's very content focused, focusing on research and evaluation strategies, on evidence-based strategies for reducing recidivism, and there will be some pretty detailed sessions in there about things like motivational interviewing and using ethics as a training tool. So all of that to say, it is absolutely not essential that the financial point of contact attend the conference, and in fact, I would recommend sending another member of your staff. The next question we have asks by what date we can expect to be contacted by NRRC TA advisors. You should expect to be contacted around late November. Of course, if you have questions in the meantime, you should certainly feel free to reach out to us. I'm going to scroll back to that last slide with contact information. And please do not hesitate to contact myself with whether it's questions about the conference, about your some specific grant strategies, and we will dive in individually, though, at the end of November. We don't have any more questions in the queue, so if folks have anything else they'd like to ask, and also if you don't feel that I've answered any question fully, please feel free to send in a request for clarification. We'll just give that another minute or two before wrapping up. All right, well, if there are no other questions, then this concludes our webinar. We will email a link to the recording of this presentation, as well as a link to a PDF of the slides used in the next week or so. These links will also be made available on our website, which you can see up on your screen. Again, we recommend that you go to our website and click the link before you and subscribe to our newsletter. Thank you again to Andre and to Dr. Skinner for presenting with us today. And thank you to everyone on the line for your participation. Again, congratulations on your statewide recidivism reduction planning grant, and we look very forward to working with you.